So back in 2014, I wrote an article, a newsletter for all of my patients and from my community about new medical guidelines that had just come out that were designed to get actually a bunch of senior citizens off of their blood pressure medicine. So the new guidelines actually raised the bar for where medical doctors were supposed to be prescribing these medicines to people over the age of 60 or 65, I forget which. From, at the time, 140/80, they raised it to 150/90. So if your blood pressure was below 150/90, your doctors were not to put you on medicine now with these new guidelines. And whether doctors just didn't read them or they didn't get the guidelines or they didn't care, a lot of them were not doing this, which is why I did the write-up in the first place. Fast forward 3 years, and a new study came out called the SPRINT trial, which looked at a bunch of people and said, okay, well, actually, these people should be on medicine. And in fact, everyone with blood pressure above only 130/80 should be on blood pressure medicine. So the pendulum swung entirely the different direction. And I think this is a little bit crazy. I think the whole concept's a little bit crazy of having a universal norm for blood pressure and then putting people on medicine if you don't fit within that, which is actually what this video is going to end up being primarily about, not this next thing, as amazing as it is, which is that upper cervical chiropractors have known for the better part of a century that if you have high blood pressure and you come under upper cervical chiropractic care, your blood pressure will probably go back to normal, pretty much like clockwork. And in fact, there was a study back in 2007 that pretty much proved this to be true. There was a doctor named Dr. George Bacris at the University of Chicago Hypertension Center, a very renowned medical researcher, and he was seeing a bunch of his patients were taking themselves off of their blood pressure medicine, and they were all seeing this same chiropractor on the other end of the city. And this piqued his curiosity, needless to say, as a researcher, as a scientist. And he actually, so later they did a bunch of television interviews over this study because it was so groundbreaking. And he admits repeatedly that the whole goal of this study that he was designing was to disprove this as total bunk. He said, there's no way seeing a chiropractor, your blood pressure goes down. That's bogus. So he conducted this study, got 50 people, took them all off of their blood pressure medicine, and half of the people got a chiropractic adjustment, an upper cervical chiropractic adjustment to the top bone in their neck. The other half received what they thought was an adjustment, but was actually designed not to move anything in the neck. And what they saw was these people getting the fake adjustment didn't see any change in their blood pressure. It stayed high after getting off the medicine. The other half who got a chiropractic adjustment saw an average drop in their blood pressure of 14 points systolic, which is the same as being on 2 prescription medications at the same time. So it's pretty huge. And Dr. Bacris couldn't believe this. Of course, he did now that he saw it in a clinical laboratory setting. And then after the study, and they watched them for several weeks after, a couple of months, and their blood pressures all stayed low, stayed normal after this correction. After the study, they adjusted the other half who were getting the fake adjustments. And of course, every single one of them, their blood pressure came down to normal as well. So it's pretty amazing. And there's lots of reasons why this happened. That could be a whole long-form video unto itself. If you're interested, let me know. I don't mind rambling for an hour about science at all, but that's not the point of this video. But the short version is your brainstem, which is the part of your brain that controls everything, your heartbeat, your breathing, your digestion, your hormone levels, your immune system, your reproduction health, all of those things controlled and regulated by your brainstem. And misalignments of that top bone can put stress and interference on that part of your nervous system so that it can't run your body the way that it's supposed to. And one of the very, very common things that happens is elevated blood pressure when things are misaligned here. So it stands to reason that realigning things there would alleviate that stress on the nervous system and allow things to begin working properly again. That's why that happens when a person receives an upper cervical chiropractic adjustment. Their blood pressure comes back to normal, among many, many other things that go right for that person. That brings us around to what I really wanted to talk about here, which is just how crazy this other model is. So we started looking at blood pressure clinically in the early part of the 20th century, and that was just doctors noticing in their own patients, okay, this person's blood pressure is around this, they have these other health conditions going on, this other person, their blood pressure is lower, maybe they have different or no health issues going on. It wasn't until the 1940s, I think 1947, 48, that a large study called the Framingham Heart Study actually began to be conducted. It's still going on to this day, to my knowledge, which makes it one of the longest running scientific studies in the world. And they are looking at tens of thousands, maybe hundreds of thousands of people by now with high blood pressure and doing all these correlations with other health factors, so especially heart health in particular and heart disease. The problem here is, so you look at tens of thousands of people and you say, okay, well, on average, they have this blood pressure. And on average, if it goes above this blood pressure, these people develop all these other health problems. And on average, if it's below this number, they have fewer health problems. And so they say, this is normal for the whole world, for every single individual. They should fit within these universal norms. Well, this average person doesn't even exist. He's just a statistical reality. There are lots of reasons why our blood pressure ought to change, why it needs to change. There are other health factors that can cause your blood pressure to go up. If your kidneys are not functioning 100% for some reason, kidney disease, kidney failure, or some other innate problem, your blood pressure needs to go up in order to compensate for that, to keep enough blood and fluids moving through your kidneys for that filtration process to happen properly. Hormonal issues, if you have something going on with your adrenal glands, very often it can cause your blood pressure to need to go up. Or even just more day-to-day scenarios like increased physical activity. You go for a jog, your blood pressure has to go up. Or stress, your trouble at home with your spouse, or deadlines due at work that you're not meeting. Stress, your blood pressure actually has to go up as part of the stress response, which we're going to talk about in a whole other video. All these normal situations, and yet in the medical world, all they can see is we're outside of the norm. We're not going to ask why. Okay, so maybe something going on with your kidneys or with your adrenals. Well, here's a chemical to get your blood pressure back to look just like that average Joe who doesn't really exist. Well, in that case, that's really a bad thing. Now you're dealing with two problems. One, that initial stress, which caused the blood pressure to elevate in the first place. And two, now you're putting a chemical in your body to short circuit one of your body's natural responses to that stress, which was raising your blood pressure to deal with that problem. Now you have two problems. So you see how this medical idea of just medicating away these symptoms can be extremely deleterious to your overall health. You just eliminated one of your body's defenses to keep your body functioning the best that it can, given a more temporary situation. Or, heaven forbid, it's a long-term situation, seeking out the help that you need for that situation to get that addressed so that your body can work right. And that's really where the medical world goes wrong, because the medical lie is that health comes from the outside and it comes in the form of a pill. The medical lie is that chiropractors are just part of the healthcare establishment who specialize in treating back pain at best, or at worst, they're a bunch of quacks harming people. The medical lie is that a miracle happens for 9 months and then you're born and suddenly it's time for a bunch of doctors to run your body for you to keep you healthy. And that's a bunch of nonsense. And chiropractic has an alternative view for that. And I think people are ready more than ever to hear that alternative view. So if this resonates with you, like and share this. More importantly, share it with people that you know are stuck in this model. I guarantee you know someone with high blood pressure, and I promise you that the medicine that they're on for it is not their only medicine. So like and subscribe this. More importantly, share it with friends and family so that they can get this word out. And pay attention, because there's a lot more of this truth coming real soon. We'll talk to you soon.